Now, it's such a wonderful time to be back on your screen again. Good evening, and thank you for joining me on this very informative episode of Gyna Plus on Afia TV. My name is Doris Mayem Shishe. Now, this is a program where we talk about health issues that affect women and girls and sometimes children in the society. And from time to time, we get to do special edition for the men. So today, we're talking about something really interesting. And this program, by the way, comes up every Wednesday at 6 p.m. And then you can catch up with the repeat broadcast on Saturday at 8 p.m. And we have an active channel on YouTube, Afia Culture and Lifestyle. There's quite a lot of information out there. You could check it out. And I mean, like I mentioned a while ago, today is going to be a discussion that would open our eyes and minds to something that we know, but of course not quite intentional about. And that is health literacy. And we'll take a break. And right after that, you're going to meet Dr. Brenda Akanisi, someone you know very well. Please stay tuned. We'll be back. Welcome back. If you just joined us, you're watching Gyna Plus on Afia TV, and it's such a wonderful time to be on your screen, like I'd mentioned before. And because I said we are discussing something that is, is something we live with every single day, but how intentional are you about knowing little information about your health, when there's a little change, when to ask the right questions, where to get this information? That's all that we'll be talking about today in one language called health literacy. And to join me on that is my very beautiful Dr. Brenda Akanisi, looking very colorful.
You know, like this,
oh yeah, like drum rolls. Dr. Brenda, good to have you.
Thank you so much, Doris.
Yes, if you're meeting Dr. Brenda for the first time, she is a family and lifestyle medicine physician, and she's someone who is quite passionate about women's health. And this is our first outing for the year. I know we started off with the health insurance thing with a man this year, but then again, it's good to have you, Dr. Brenda.
So for me, I would say Happy New Year, because this is the
Happy
first.
New Year in February.
Yes, for me, that's what I'm saying to everybody out there. For me, from me, not from her.
Okay, of course.
For me, Happy New Year.
Yes, it's good to have you back.
Thank you so much.
Now, let's talk about health literacy.
Okay.
This was you talking to us about the fact that the things you see every day, the awareness that you notice, there's a gap in awareness and knowledge with patients you've encountered and all of that. But before we talk about what people should know, questions they should ask, when we say health literacy, just put us through the basics and then let's start from there.
Okay, so firstly, I would like to say thank you for bringing up this topic. It's quite timely. And I say timely in the sense that this is the beginning of a year, so everybody can have the knowledge or the desire to seek knowledge concerning their health moving forward, so that whenever they happen to be in the space where they are healthcare practitioners, they can ask the right questions so that they can get maximum result from the information they've gotten so far from people who know. So I would say health literacy is a concept that basically talks about how you can seek information concerning your health. Also, when you seek this information, to use it to gain more knowledge. So how do you get the knowledge? Where do you gain the knowledge from? And how do you use it to improve your overall health? And let me just give you a typical example. I was at a pharmacy 2 weeks ago, and someone entered inside to get medication. He obviously came with a prescription note from his doctor. And the medication he was looking for, there were two components of the medication in that particular brand. Now the pharmacists were trying to explain to him that, okay, they have the two components are separate, so they will sell it to him separately, but he can combine it to get the desired effect as it was prescribed. So later on, I could see the client, or let's say the patient, was struggling to understand, okay, how is he going to take it based on what was written and how. So the pharmacists, I'll give them, some kudos. They were quite patient to explain to him, okay, you take this one in the morning, then in the evening you take this. So they spelt it out. At that point in time, that is what you called health literacy was happening. Now, based off, I don't know the person, I don't know him or know his educational level, but the little I could say is that he looked, well educated. So you can see that education, for the fact he was educated, did not translate to him being health literate. So for the fact somebody is, you can be very knowledgeable in the tech space and all that, but you may be deficient in matters relating to health. So that is why you need knowledge about it, so that it's easy for the information your doctor gives you for you to be able to use it and get better at the end of the day. So basically, that's just what the concept is. And as we talk further into this conversation, we'll just give more examples of how to seek information and get the right information for a better outcome.
Thank you, Doc. So before we even get to the reproductive part of it for women, because I know that would come up.
Yeah.
One we want to ask about sources of this, health information.
Yes.
I know because we are quite in a digital world, it's easy to just go up to, the internet. And then if I have a symptom, I'm like, okay, I have a ball in my armpit. What do I do? And then series of, list of medications will come out even before seeing a doctor. Does that also translate to being, aware health-wise?
Yes. So the part of the source of you getting health information can be from the internet. It's not something you should shy away from. You can go there and seek information. But the thing about it is that do not solely depend on the information you get from the net, because you don't even know how to. Sometimes I see people not using the internet properly in getting the right information. So let's say, for example, now you just see somebody you're watching a YouTube video and somebody tells you, oh, if you take this tea, then it cures A, B, C, D, and it does this, and if you exercise this, and now I will say yes, it kind of stirs something in you to want to know. So for example, let's say somebody
even try it.
Yeah, do you understand? So it stirs something in you, which is a good thing. So now what you do next will now determine the outcome. So if you get this information and say, let me go to some research website that are renowned, and go there and you type in whatever it is you're looking for, then you can see work that has been done by people in that field. People, like, this is a series of research. They've taken their time, they've analyzed it, they've looked at different sample size and all that, and they will now tell you, okay, this is the result we found, like A, B, C, D. Do you get? Then you can say, okay, this resonates with whatever I watched on whatever platform. Then it makes sense. You understand? But some people will just take that one sentence they saw and run away with it. Let's say, for example, now somebody is having fever, and you just go there and they say, fever is caused by infection. And you just say, okay, because of that, then you just start taking antibiotics. Or fever, malaria causes fever. You just start. Doesn't make sense.
Treating malaria.
Because there are a lot of causes of fever. So now it can help you. For example, you kind of say, okay, fever, it can be this, it can be that, it can be this. So now, with that level of information you have, when you go see your healthcare practitioner, it gives you more knowledge to be able to discuss further, so that you can get more clarity. Because to be honest, there's some patients who really want to know. And the reason why they want to know is not really to challenge your level of expertise. It's just because they want to truly understand. And I'm going to give you a very practical example. And that's concerning my dad. He's late, may he so rest in peace. I remember when we're going to see a consultant, actually a professor of cardiology. It was a senior colleague. And I remember I went there, and my dad came with his pile of medication. And he was trying to explain, okay, this one I take. Of course, now he may know the class of drug because, he has some level of information, because this is something he has been dealing with for years. But he may not know the actual pathway of how that medication works, right? So when he came, he was saying, okay, this particular pill, I know if I take it from this time to this time, my BP will come down to a certain level. Then by this time, and it was so funny how the professor was just looking at him. I was like, okay, sir, which time do you get to sleep if you're busy monitoring your BP? But for him, what he was trying to do was to keep a track record, to see and understand his body, understand, okay, this drug does this. And the beautiful thing about knowledge is that when he brought that information and he discussed with the professor, they reached, the treatment plan from him was for him. It was specific for him. Because they now realized, okay, this one brings it down to this level. So he was now advising him, okay, I suggest you take this one by this time, take this one by this time. And both parties went away feeling happy. Yeah. And the result he got at the end of the day was something good. Yeah. So I'm just trying to tell you that it's a collaborative thing. So when you get that information, still meet your healthcare practitioner, then you people can come up with a plan that best suits you.
Okay, I like the fact that you said healthcare practitioner. Maybe we'll talk about a patient healthcare. Because I'm going to come to that question later on. But before we take a break, I'd like you let us be a bit more practical.
Okay.
When I said I need to be health literate, for instance, if I want to qualify or classify myself as someone who is health literate, what are the things that qualify me in that space?
Okay.
What kind of knowledge? Is it about my body? Is it about the medication I take? Is it about my food? Is it about knowing that something has changed? I'd like us to just break it down in that concept. Yeah.
Okay. Beautiful. I like the angle you brought. So now if we break it down from, let's say, okay, let's go to the, okay, let's start with you, like your body, right? There's something about people know when something is not right. Now, there's sometimes you can come to the hospital and just be like, doctor, I'm not feeling, there's a way my body is doing me. And they've run all the tests on you. And nothing comes out. And you're still insisting that, I know my body. That to me is power. That is health literacy. Because you have studied your body. So for you to know there's something wrong, that means you already know the normal to get to the abnormal. So if you don't know the normal, so that is even a plus. That means the person has taken the time to say, okay, no, I know normally I don't have fever by this time. I know maybe, during this...
It doesn't come with a rash. I know my body.
Do you get, for example, I know if I eat A, B, C, D, I don't have a reaction to it. But if I eat C, D, B, I get... So that means you've studied your body. So that is health. And people like that are observant. Because they'll notice, how do people find out they're allergic to things? They take something and be like, I noticed when I did that, something happened. Do you get? So now they avoid that thing. So that is you being literate. So that means you know your body. You've taken out time to study your body to find out, okay, this works for me, this doesn't work for me. Even when we're even seeing our patients and we're taking history, we also ask you, is there any medication you've ever taken that you've reacted to? And that is based on something you have observed. Then maybe you give us the particular name of the drug. We'll now realize, okay, maybe, this is a sulfur-containing medication. Okay, that means any drug that has sulfur, maybe, you react to it. I remember most of the time they ask you, does chloroquine eat you and all that? Then when you say next, they will now... Do you understand what I mean? So that is because you have taken cognizance of the fact that, okay, I've observed that this medication does this to my body. So that is based on you knowing your body. Now, in terms of moving on to the next way, I say, okay, diet, right? You also, there's some people who will tell you, okay, this food works for me. This food doesn't work for me. I will tell you there's some meals I will take. I'll be like, this will make me put on weight. But somebody else will eat it and nothing will happen. That is me understanding my body, right? Now also you get to, in terms of your knowledge about medication, just like the way I said, if you react to some certain drugs and all that, what drug works better for you, you get. So you have, you knowing that is, increases your level of health literacy, because that was the question. You say, how do you know somebody? So with each of this sector you've got, from knowing your body, knowing what you eat, what works for you, even in terms of like exercise. Yes, as lifestyle medicine, I'll come here and tell you exercise. Now, it's not every exercise you give everybody to do. Do you get? If somebody comes here and tells you, I'm having knee pain and all that, it doesn't make sense to tell the person to start skipping. Jump, It doesn't make sense. So you have to find something that will still engage the person physically, but not compromise that particular area the person is feeling pain or anything. Because even in medicine, I remember then when, as a student, when you're trying to palpate, touch a patient during an exam, and they will tell you you're not meant to inflict pain on the patient. So once you inflict pain, it's a minus for you during exam. So they're just trying to tell you, you have to. So I may go to patient A, do like this, and the patient doesn't flinch because there's no pain. And I go to patient B, but now why they're insisting on that is that to train us in such a way that, did you ask patient B if she had a pain before you went there and you just assumed, there's no pain? So that it brings a level of, for you to be detailed and realize that each patient is different. Do you understand? So yes, in summary, health literacy encompasses you being knowledgeable in each area, but knowledge keeps increasing every day. Because even us as healthcare practitioners, you keep learning every day. That's why they do update courses. That's why you have webinars. That's why you have seminars. Because sometimes they will tell you, you have to get some certain number of points every day before you renew your license. That is because education is continuous. So you have to open your mind to be able to say, I want to learn more about my body. I want to learn more about things relating to health in general, so that I can have a better outcome. Now, let me just take, for instance, when COVID happened, let's give an example. People had to be literate to protect themselves. Everybody was wearing face masks. Why? To prevent what? You get. What is everybody using hand sanitizer?
Yes.
That is health literacy right there. But so because we've not tagged it as something, you don't know that you've been practicing all this while. So the whole essence of having this conversation is to make it practical. You cannot say, they told me to use hand sanitizer, I'm not going to use it because I don't believe in it to. Do you understand what I'm not going to wash my hand? That minute they told everybody, wash your hands, stay indoors. Everybody complied. It wasn't a thing
because they knew the implication.
But guess what? So people who are not in the healthcare sector started reading more about it. So and that is what
awareness increased.
Awareness increased concerning it. Do you get? So it's something that is a concept that we don't know we've been doing, but now we've brought it to the front of your table and be like, what you've been practicing is called health literacy.
All right, Doc, thank you so much. I like the fact that this is coming up now, just like when we started the year with health insurance, knowing what to do, at what point should you, get a package so you don't get to pay too much bills and all of that. And the second part of this is more like, it's just in line with it is, after you've done all of that, at what point do you know that something is changing about your body? Right. You need to be aware. That's the essence of this conversation. So we'll take a short break, and right after that, we'll look at it from a more reproductive point of view. As a woman, what should you do? At what point should you see that something has changed, and when should you see a doctor? Please stay tuned. We'll be back. Thank you for staying tuned. You're still watching Gyna Plus here on Afia TV, and we're talking about health literacy. And Dr. Brenda has been doing quite a wonderful job. So if you just tuned in, I can tell you missed quite a lot. But then again, this will be up on our YouTube channel, Afia Culture and Lifestyle. And this program airs every Wednesday at 6 p.m. So, Doc, we talked about quite a number of things, from what people should look at for what constitutes health literacy, to the signs you should watch when your body changes and all of that. Now, let's talk about women particularly. Because I know that times where sometimes you could have your menses starting at point A. Let's say in January, you had it on the 13th, in February, it's coming on the 14th or something. For a lot of us, it's not something we particularly pay attention. Especially, maybe you get pregnant for instance, and then you go to see a doctor. They ask, when was the last menstrual period? You're like, it was 2 weeks back. You can't pinpoint a particular date. How much of impact does it have when it comes on women, especially in the context of being, literate about your health?
Can I be honest? Sometimes when you see, let me put it this way: if you're younger, you're a teenager, and you come into let me say I'm consulting, and I actually made your last menstrual period, I kind of will give you a pass because you're young. You're just coming. You probably just started your menstrual
it's okay not to remember.
No, I'm saying it's okay, but sometimes you can make an excuse because she's just getting acclimatized to it. Now, let me put it this way: if she comes in and she's in her teen, and somebody comes in and she's in her 20s, and somebody comes in and you're 40, I expect somebody who's much older to be more to remember, to be more practical in remembering their dates, because it doesn't hurt to just get your phone and you type in maybe this particular time in the month. Once you notice your period starts, just log it in. Just log it in. Even for people who, once you notice signs of ovulation, just log it in. Everybody holds their phone most of the time, so it's just easy for you to type. So let me give you an example. Sometimes when you refill your gas, don't you store refill gas so that you can
recall the next when you might like it finished.
How long it lasts. Let's say you have a nanny in the house. You want to know how long it lasts, to know that is she cooking something when you're not around. Is she cooking for maybe somebody else that's coming to visit her that you're not aware about? You understand? So if you can do that for the things you have in your house, even women, if they buy a gallon of oil, they know how long this thing should last. If it finishes before that stipulated time,
questions begin.
So that is you seeking knowledge concerning that.
The household.
The household stuff. So the same thing, it comes to your health. It doesn't cost you anything. Now we're shifting it more towards women. So little things like that, track your menstrual flow, so that when there's an abnormality and you're talking to the doctor can, it makes the management easier. It makes it easier. Even for people who get pregnant and do always their last menstrual period, it helps you to calculate the gestational age, how far gone the woman is in her pregnancy. So it's a key information that helps in overall management. Now, let's say you have a track record of how you've been keeping your flow, and you just show it at one glance to the physician. He can make, and he can look at it and say, okay, this thing seems to be regular. He can tell you whether it's regularly regular. Do you understand? And that now helps him to think of, it may be this, and now makes the management quite, straightforward. Do you understand? So, yes, it is important for you to track some of these things. And now, I will also say this is also probably talking to those in the healthcare space. If you notice that your patient comes in and she's not doing it, you're in a position to educate her. Let her not leave that room without the right education. So even if she comes and tells you, it's missed period, and you be like, have you tracked it? Last month, where was it? Last 2 months, where was it? And you notice that she is not adequately keeping this record. After you have treated whatever brought her to that your facility, give her the right information. Explain to her, this is how menstrual flow works. This is why you should keep track
Regardless
of
of
it.
the age.
That's what I'm saying. Regardless of the age, once you notice there's a gap, please try and fill in that gap, because it will help her and help you when next she presents with something relating to that.
Yes, let me quickly, maybe come in. There's something, the ovulation thing you mentioned, because I think it's part of being aware about your body.
Yeah.
A lot of us women do not know what it looks like, what it feels like. You say, oh, I'm in my ovulation. So when you say track, for instance, when you're ovulating, some people don't know. It just sounds like it's just a word that exists, but you don't know when the body actually feels that way.
So now that's the thing, because if you look at all the episodes they've been doing so far, Ghana Plus has been dishing out. Oh, there's a lot of information packed. So that's why I don't want to zoom in on any particular, gynecological or obstetric this thing. But I'm just trying to say that is where information comes in. So even if you want to read the internet and be like, oh, what's the signs of ovulation? Or maybe breast tenderness, you start seeing there's a kind of sticky, discharge that comes out. So you can take note. Okay, saw the sticky discharge today.
Okay, that should be it.
Do you understand?
And
so
then monitor for subsequent months if that happens.
And see, okay, does it happen as particular? Even for those who are doing breast self-examination, because that is part of health literacy. You are aware that you're meant to be doing your breast self-examination. Do you understand? So let me break it down, because we're ready for women now. So we'll have the sexual and reproductive angle. So that means you should be knowledgeable about your menstrual cycle. Know what is normal, so when an abnormal thing happens, you know when to seek help.
Know when the cycle changes.
Know about STIs. So let's say now that guy wants to touch you, and you'd be like, let me be more responsible. Your husband, even if you notice there's a change, I'd be like, sir, why is this rashes here and all that? With that information you've got, you can go and check it out and seek help. Do you understand? So that has to do with now sexual and reproductive. Now move on to what do you call it? Around pattern period, like postpartum, prepartum, and all that, when a lady is pregnant. Now the information helps you during that pregnancy. So people just go for antenatal care. Of course, the antenatal care, they give them right information and all that. But also it's for you to know, okay, this is why I have to go for the visit. This is why I have to keep my appointment. Now let me give you a
questions to ask
of good health literacy and poor health literacy. Let me just use a pregnant case. Yeah. Let's say now she's about to she's traveling out of state. And maybe the last time she went for antenatal care, they gave her medication that was meant to last her for 2 weeks or 3 weeks. Now, good health literacy would say, let me inform my doctor that I'll be out of state. And my medication may not last me till I come back. Giving him that information, if he's going to write 3 weeks prescription, he can decide to make it 4 weeks. That is good health literacy. So because you're aware of the benefits of this antenatal medication, you have said, okay, you know what? I don't want to miss a day. So let me inform my obstetrician and let him make sure he tops up to the number of days I'll be away. Now, poor health literacy is, I'm traveling. Okay, you just pack your things and go. Whether the medication finish or not, you feel like, it's not just 5 days.
Oh yeah, I think that's
the thing. It's not just 5 days. 5 days is not after
not too much.
It's not too much.
I'm taking every other day.
You get. So you can see this is just a clear example of good health literacy and poor health literacy, because the one who is in it like, oh, kill a big deal, doesn't know the importance of why you need to take it. And now, because you even informing your obstetrician that, oh, you'll be away for a while, if it's a pregnancy that seems risky, he will tell you, is that trip really important? How are you traveling? Are you going by road? Are you going by air? And all that. So you can see where, because you know the importance of this visit.
You talk about it.
Yes, you talk about it because you know you want a good outcome, which is a healthy baby at the end of the day. So a healthy baby at the end of the day. So that is what is all about concerning health literacy. Even with health literacy, it helps you to know, okay, you know when you're having low moods and all that. When it's persistent, health literacy tells you like, okay, this is not just low mood of, there's no money in your accounts. This is a thing of, okay, it's becoming persistent. I need to go and see somebody. Maybe this is getting to depression. Or maybe somebody opens the door every time and you're jittery. Okay, you know what, this is happening too much and it's getting excessive.
And it was
anxiety is anxiety building up? That health literacy makes you be like, you know what, let me stop getting comfortable and go and seek help. And the beautiful thing about it is that the minute you seek healthcare on time, you have better outcome.
Yeah.
So that is the whole concept about,
all right.
women. and seeking help literacy.
I mean, quite on point. It's been an eye-opening topic, I would say. But before we go, we'll take a break, and once we come back, you're just going to, round up from the angle of asking questions with your healthcare practitioner, because I think I've had quite experience about that, and I'd like you to briefly talk about it. That will be after the break. Please stay tuned. Ghana Plus will be back. Welcome back, and it's getting really interesting. If you just tuned in, this is Ghana Plus on Afia TV, and we've been talking about health literacy. As simple as this word sounds, there's a lot that you should know about it. And Dr. Brenda is still here doing so much justice to that topic.
Thank you,
and just for want of time, I like us to be a bit straightforward.
Okay.
And when you talk about the fact that if you go to a hospital, you should ask questions. If you see your practitioner, raise concerns. There's a particular one that's quite common.
Yeah.
In some hospitals now, in this Enugu like this, let's say you are admitted for a particular concern, and at the end of the day, you have prescriptions. They notice that they don't give you medications that have the names on it. They just cut it. And at times, I'm speaking from a practical point of view. Something that's happened to me about 2 times. And when you ask, what medication is this? What is this for? What is this for? They just tell you, do you want to treat yourself, or go to the pharmacy? They will give you, and they just pass your file, and then the next thing you just see 1 times 2, and you don't know what you're taking. So, and if someone who wants to be aware about their medication or keep a track record, or if they want to change a healthcare provider, how can they provide information in that context? So I'd like you to talk about that and how people can go about it the right way.
So it's good. Oh, thank you so much for bringing it up, because I tell people, if you've ever gotten a prescription from abroad, it's clearly written. The medication, how you should. They don't even put 1x1. They write once daily per oral. In fact, they even put via mouth, so that you're specific. Because there's some medications you can actually take through, the anal opening. Do you get? So they are that detailed. There's a reason for that. Now, I also know some healthcare people in the healthcare space can say, oh no, the reason why they don't tell patients the name of the medication is that sometimes they go and self-medicate and all that. But it's also a disadvantage, because the person can be in another state, another doctor, and they'll be like, okay, what's the last medication you took? And the person is like, I don't know, but I know it's green. I see that a lot. Oh, I know it's a pink one,
small,
it's red.
Tiny.
That doesn't mean, I'm not meant to know the colors of medication. So it's a waste of, you're wasting my time and your time. So for me, I will clearly say this without apologies. I do not think it is right for people not to know what they are putting inside their body. They have a right to know which medication they are taking, and they also have a right to know how to take it properly and adequately. And that is why we're having this conversation about health literacy. So I'm talking to both parties, the healthcare providers and the healthcare people who are receiving the healthcare as well. You have a right. Personally, I do inform my clients, this is what you're taking, and this is how you should take it.
All right.
Do you get? So that the next practitioner who gets to see you, is easy for the person to have the conversation. And I also encourage them to also know the medication, not the brand name. Know the medication of what is taking. Because I've seen issues whereby there was a young girl who was being managed for seizure disorder, and at the point in time there was a delay in records finding her file. That was when I was working in the north, and finally it was taking forever, and the girl had been there since morning. So we said, okay, let's just open a new folder and be seeing her while they're searching for the old one. So I'm not saying, okay, you've been on this medication for a long time, what are you taking? She didn't know the name. She was quite young. Her parents who came with her didn't know the name. She didn't know the name. So imagine if she just knew the name of the medication, it would have saved us a long time of searching, or that long consult time, which would have saved our time. So I'll just say, there is power in knowledge, there's power in information. So please, it is your right to seek information and seek the right information. And also, please, the way you also
go about it,
the way you ask the healthcare practitioner is also important. So I also think
as though you're teaching them their job. Because
there's some people who ask in a very rude and demanding and authoritative tone. It's not very right. So I rarely would see a doctor who, when you ask in a very polite tone and say, okay, sir, please, can I know this? And this is why I want to know it. And some people come with this, and what am I taking? What's that?
What is this for?
What is this for? Like as if you're, what is this? Do you get a hand? So when you ask in a way that is very respectful, most of the time they'll dish out the information.
All right, thank you, Doc. I mean, we're just out of time. This could have gone on and on again. Thank you so much for coming around.
Thank you for having
We'll be
me.
talking about health literacy, and trust me, it's something that you wouldn't want to miss. Or even though you missed it, there's always a way to catch up on Afia Culture and Lifestyle, our YouTube channel for this program. Thank you so much for being a part of it. We've had Dr. Brenda Akanisi, a family and lifestyle medicine physician, and there's more of these interesting topics that will be coming up in the subsequent months. And in the meantime, do remember that my name is Doris Mayushishe. Have a lovely evening and see you some other time.